Hi, thanks for stopping by today. Today I'm going to be talking about pain scales, and there's one in particular that's a pet peeve of mine. And I'll be talking about other types as well and who benefits from pain scales. And I'm not a doctor, I'm not a pain specialist, but I do have many decades of experience as a patient and have often been given pain scale forms to complete. One of my biggest pet peeves is the pain scale where you are asked to rate your pain on a scale of 1 to 10. And I'm sure we've all come across these if we've had an injury or been in some type of pain. And as we know, it's quite subjective, so your level 5 may be different than my level 5. And I find them very difficult to complete. Now, if you have a typical type of injury where you have a steady progression of healing, these types of pain scales can be workable and rather easy to fill out. But if you have chronic pain or the type of pain that can vary by the minute, by the hour, it can be impossible to clearly state your level of pain on this type of scale. So what I usually do if I'm confronted with one is circle the entire scale and say, on average, my pain level varies each day from a 2 to a 7, or whatever yours might be. And most offices have accepted this. Some have not been too happy with it, but that was the best I could do. And when I asked them if they had a different type of scale for me to use, they did not. Now, you may find if you were at a specialized pain clinic that they may have a much more variety of pain scales available. But what I have seen 95% over the last few decades has been this typical 1 to 10. And I am just not a fan of it. One of my doctors in orthopedic understood the limitations of the scale, so what he would do on his form, he would put a note, state your pain level now, and now is in big bold letters. But the problem was patients would commonly sit in that waiting room 1.5 to 2 hours before he actually saw them in the examining room. So overall, it really didn't go too well, because by the time he came in the room, their pain level had changed. So they had to be sure to tell him it was not what they had stated on his form. Now, these typical 1 to 10 pain scales became really widespread back in the Clinton administrations. Typically, my understanding was they were supposed to be used more for research, but during the Clinton administration, he had signed into law making pain control and pain research much more prominent. So we began to see also more veterans and more of a growing elderly population. We also saw addiction rates rising with people who required pain medication more, so they wanted to assess the pain. So we saw more involvement with, for example, the Joint Commission, who accredits hospitals, so they started to get a little more involved, requiring stricter requirements for hospitals to assess their pain. And this pain scale became quite widespread, as we know, and they got a little bit overzealous with it. So it's just a very frustrating, in my opinion, and I think what's really important is doctors to be sure that that patient is utilizing the best pain scale for their specific situation. And I think that the doctor offices, for example, that I've been to, the ones that had limited selection of pain forms, really need to focus on being sure they have more of a variety available. And I think in some of these pain clinics and pain specialists, obviously I think they're going to focus more on zeroing in on the proper type of scale for you. And again, I'm not a pain specialist, but I would imagine that to be the case, so that's a good thing. But I also think that the doctors and patients have to understand how they're each defining pain, and this is a huge issue that needs attention to, because some patients, for example, may not describe pressure as pain. I have pressure in my bladder, but for years I thought of that as discomfort, not pain. So I would state in my forms that I was not in pain, which misled the doctor a bit in their analyzation of me. And I also had a friend who was actually having a heart attack, didn't know it, did go to the hospital, and they asked him if he was in pain, and he said no. And the reason he said no was he described it as intense pressure. And that did severely affect what happened in his situation. So you see, there's a great need for an understanding of how the patient and doctors are both looking at pain, how they're defining that. Now, there's also the insurance company involvement. If you have a typical 1 to 10 pain scale, of course the insurance company is going to want to see a steady progression of healing in order to justify continued payment, for example, for physical therapy. And some of the downfalls is this: I have personally seen a pressure on patients, and I've experienced this where you better come up with something goods to justify that insurance company paying. When I began to hear things like this, I opted out and I paid cash on my own for situations where I felt I might be in like this. So most of the time I paid cash for my physical therapy, even though one might argue that's quite expensive. I felt I got much more thorough treatments, less time wasted filling out forms. So I was very happy with it overall. Now, there's a lot of different types of pain scales available. I know the 1 to 10s was often thought to be a little bit abused by those with addictions because they might fill out a higher level of pain than they really were in because they wanted to get that pain medication. So there's a lot of other types available. We have pain scales with faces that might show from smiling to weeping or wincing, color-coded pain scales. There are also veterans may have their own pain scales to use. They have designed a special pain scale. I know it has something to do with the typical 1 to 10 in a way, but also some faces and questions they fill out. And I'm not a specialist in that, so I don't want to say exactly what it's about, but I have heard about that. Some are observational and can be quite necessary for doctors in cases where patients cannot report their pain on their own or they cannot speak. So some of these are actually quite beneficial. And we could have other types of number scales, where the scale's more of on a sliding continuum scale. We can have descriptive pain scales, which I tend to favor if I had to fill one out, where you describe your pain or talk about how it affects your levels of activities. And those I think can be beneficial. And some patients actually might create their own along with their doctor in a way that they feel that they can best describe their pain. So that's my take on pain scales. Overall, I'm not a fan of them. I find them to be stressful and disruptive and take too much time for the visit. But I am in favor of, if for some reasons, as I discussed in this video, and I do think it is good if patients are asked to describe the pain and how it affects their day. I just think it can be very difficult to put a number on pain. And I know I have talked with hundreds of patients over the last 40 years, and not one of them, and there were many I talked to who had pain scales to fill out, not one of them felt the pain scale helped them in any way. Now, I realize there could be patients out there who like pain scales, and obviously professionals and doctors and nurses who find them to be extremely helpful for their situation and their needs. And I do understand that I'm talking solely from a patient perspective here, that I am not a fan of them, nor have I ever talked to anyone that is. So we have to look at how are these pain scales helping patients. After all, we do want the patient to be helped by this entire process. So that's my take on pain scales, and I hope you'll join me next Friday. Bye.